Hi there, my name's Catherine from Altrincham Physiotherapy Clinic, and today we're going to introduce our new series of 10 videos which is aimed at helping you with lower back pain. Lower back pain is one of the most common conditions that we see here at the clinic, and it's very common in our population as well, with up to 70% of people experiencing an episode throughout their lifetime. The next series of 10 videos are designed to give you a safe and progressive way to help to manage, reduce and also try to prevent reoccurrence of any episodes of lower back pain. Unfortunately, our modern lifestyle with being sedentary, maybe heavy lifting and things, all has an impact on our spine. And one of the best things that we can be in control of to help both to reduce any episodes but to prevent them from happening maybe at all is to try to make sure that we promote our posture, we keep our spine mobile and supple, but we also give those muscles that support around our spine the best chance to work and give them that control. The exercises in the video should all be done within your pain limits, never push into pain. Listen to your body. You might find that you want to watch some of the videos before you do them. You may also find that you want to do one of the videos a couple of days before you feel comfortable to be able to progress on to the next session, and that's absolutely fine. You might also find that you want to come back at any point if you feel that you're having increased problems in one area at all. The first lot of exercises are going to be done in lying. If you've got a mat or you've got a rug at home, you can do them laid down onto the floor. If you're not comfortable with that, you could also do these first set laying down and onto the bed. You want something to support your head and neck, a folded towel or a small cushion. And we're going to come down and start in lying onto your back there. Make sure you're wearing something comfortable so that you don't feel restricted by clothes or have anything in your pockets at the time of doing the exercises. And the first couple we're going to do are just looking at starting to give you some mobility of those structures around your spine. So we're onto your back and you're going to use your hands to help. Lift one knee at a time so you start to ease your thigh in towards your chest. And then using the hands again, we place the foot back down. Now you're actually here using the strength and power in your arms to move the weight of the leg there. So it's a great way of being able to get a little bit of a stretch into the buttocks, slightly into the lower back, into the back of the thigh. You can have your hands underneath your knee there so you're not pressing over the front of the knee joint, and you're just easing that leg in and then placing the foot down as we walk side to side. Once you've done maybe 5 each side, what you may find you want to do is to hold one for just a little bit longer there, counting slowly up to 10 and then placing that foot back down so that we give those muscles over the back of the thigh that little bit longer to just adapt and change. Then placing the feet down, we can zip the feet and knees together. Let your arms rest comfortably so you have a little bit of space either side of your body there, and we begin to allow the knees to rock side to side. Let the weight of the leg gently carry the knees across. Now here your hips may come away. We're not forcing the movement, you're not pushing the knees over to the side at all. Just allow those knees to gently rock like a pendulum on a clock. So these first two exercises are looking at mobilising the small joints through the spine, but also mobilising the muscles, getting the circulation going into that area, which will allow us to get better work, better recruitment with the muscles, but also a better stretch into those structures. Maybe around 10 each side, just gently, not forcing. Hopefully towards the end of the repetitions you'll feel that you've been able to get that little bit more movement, and then you can come back and stop into the centre. Now the next set of exercises is looking at starting to increase some control in recruiting those muscles that help to support us around the spine, and this is really important to help prevent reoccurrence of lower back pain. These exercises are best recruited in what we call a neutral position, so a position where the spine is in that optimal position for them to work. We're starting this in lying because we're in a very supported position here, but obviously these muscles will then go on to work for us when we're sitting, standing and walking. But if we initially get them working in this laid position where we're most supported. It should be the easiest way for us to focus on getting them working well. So on your back, you start with your feet together. We'll turn toes out and then bring your heels in line. So you've got a steady base with your feet at hip distance apart and your thighs in line with your feet there. We're going to think of our positioning. Initially, head and neck. So make sure your head is supported onto your towel or cushion. We nod the chin gently, thinking of a piece of string just lifting and lengthening us away through the crown of the head. Shoulder blades gently sink down, opening the collarbone wide so the neck remains nice and long. From here then, from that second focus, we're coming into our third focus of our ribs and allowing those ribs to gently soften down there and starting to get a little bit of connection just running between the ribs and pelvis. The upper body now is nice and relaxed, neck is long, shoulders set, ribs softened. Coming into our fourth focus, we're thinking of the position of our pelvis. If you use your fingertips to rest onto those bones either sides of your pelvis, we can go into our small pelvic tilt. Gently tucking your tailbone under and release. So we're feeling a roll through the base of the spine. You'll probably feel maybe a little bit of softening if you tucked your fingertips just in underneath your lower back there. A little bit of softening with the base of the spine as you curl round, and then more space as you release that little bit. If you imagine these bones where your fingertips are resting, they have little headlights shining up towards the ceiling. As you tuck under, the lights come to shine more overhead, and as you release, they tilt down and go to shine more over your foot area. And that's feeling the movement that you can get with the pelvis and through the base of the spine. It might be quite little, it might not be a very large movement, particularly if you're quite stiff in this area, and don't worry. Once you've completed a few repetitions here, we want to set into what we call our neutral position, and that's neither as far back as you can go or as far forwards as you can go. It's halfway between. So again, if we imagine those headlights shining up towards the ceiling, we curl round and we feel them come and shine further over our head. We release forwards and we allow them to go and shine further over our feet. We come halfway back then. So we're stopping in that mid position, feeling that those headlights are shining directly up towards the ceiling. We're now in our neutral posture with our pelvis, and that's one of the optimal positions for us then recruiting these sling of muscles or this natural corset that will work to help give the spine some stability. To think about recruiting those muscles, again, if we use fingertips to help, feel those bones either sides of your pelvis, come in an inch into your tummy and then lower an inch just down into your groin a little so that you can press into those deep tummy muscles. We're not feeling the large abdominal muscles on the outside. We want to think about the muscles that sit like a sling underneath that area. So we're applying a little bit of pressure with the fingertips, not so it's sore. And then if we think about engaging our transverse abdominis muscle, so this is a muscle that supports around the spine, that natural belt, if you like. If you think that you've got a piece of string attached to the back of your tummy button, and we're going to gently just start drawing your tummy button through to your spine. It's a gentle, slow movement as we pull in, and you may feel with your fingertips that you feel a little bit of firming into your tummy, and then release. And if we repeat that again, thinking of gently drawing your tummy button through to your spine, and release. Now sometimes, particularly when it's the first few times you've done it, you may well not really feel much of a firming as you draw in, but what you may be more aware of is that release. And as you release that sensation, you feel that actually, yes, I can feel that it's softened into there. And from feeling that release, we know that we're being able to just work those deep stabilising muscles. You shouldn't feel that your tummy is sticking out at all. You shouldn't feel as if you're about to be drawn up forwards into an abdominal lift or anything. Now, it's not those outer muscles, it's the deeper muscles that sit inside underneath. Sometimes people prefer to access this group of muscles by working your pelvic floor. And if that works better for you, you could have a go to see. Think of gently drawing in with those muscles that you'd use to slow down passing water. So less of a feeling of drawing backwards with your tummy button, but a gentle lift inside. Again, gently and slow, and then release. So it's not a sharp, fast contraction. It's a gentle, slow lift or movement, and then a smooth release. Have a little go at seeing whether you find that you feel it easier to access those muscles, either by using that cue of the pelvic floor, the slowing down passing water, or the drawing in of those abdominal muscles, as if you were doing a belt up an extra loop, that pulling of your tummy button through to your spine. And see if you can practice working up to holding it for 5 seconds, then releasing it 5 times, maybe 2 sets there, so you've done 10 all together.